So, Chika, um, I know you work with the community most of the time. So you are a community person dealing with vaccines. So from your experience working at the community level, what structural barriers mostly affect our healthcare access, especially to the marginalized communities?
Yes. Vaccines, primary health care is basically based on trust. And once we have that deficit of trust, there's a problem. Let me explain. A friend of mine decided to do insurance for 200 women who were very excited. So she said, no, 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 no. I don't want you to do the government insurance. I'm going to go to Mansard. I said, no, do government. She said, no, 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 Mansard. And she did. Mansard has a community insurance package. And then the first phase was 100 women, marginalized women. And she did that. But guess what? It was a complete failure. It was a failure because the women went to the primary healthcare center and they didn't believe it. They didn't trust the system. They felt there was something hidden somewhere. So they were afraid to go. So they will go today and then they won't go and they will go. This is not a fable. This is, I was involved. So at the end of it all, trust is the first structure. Trust. The citizens must trust the system. The citizens must trust that they will get what they want from the system. And then secondly, when they go to the primary healthcare facility, how do they feel? You have the Patient's Bill of Rights. That is a law. But when they go there, how do they feel when they go there? These are all the things, these are very, very important things that people we don't take seriously, but they are very, 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 very important. So, and after that, we talked about, we don't have patients group. Do you know that with the exit of the US aid, a lot of things started collapsing? We have a patients groups, mentor mothers when it comes to the HIV programming. But because they are no longer funded, nobody looks at them anymore. It has become like a collapsed system. So when people need to go to the primary healthcare center and they cannot get their HIV drugs, they cannot get that because at that time, everything collapsed. There was nobody to talk to. Please explain to me. If you have gone to the PHC, you cannot get your drugs, everything is on collapse. What do you think will happen to them? Then they face traditional doctors. They face other alternatives and set us back another 10, 15 years. To now put the icing on the cake, we have cases where you even have, they're on strike. Some PHCs are on strike. So what does that mean? Can you imagine being on strike? How can PHC be on strike? I mean, how? So what it means that everything we have done, creating demand generation, talking about to make sure that the health systems are strengthened, using PPP, using CSOs, everybody, CSP, using Adopt a PHC, everything. Then the person goes to the primary healthcare center and silence. What will they do? They go back to all the traditional things that may not work. And then by the time everything comes together, because this one sits directly at the table of the local government chairman, the local government, because those are the ones that pay because of minimum wage and all the challenges of minimum wage. So what do you want them to do? These things are real things that happen at the community level. And before I go further, I just wanted to say that even in this, our beautiful conference, they talked about PPP, they talked about government, but unfortunately, they forgot to mention CSOs. But I'm here as a CSO rep to remind everybody, hands must be on deck if we want universal health coverage. That is why you have brought me here, the CSO voice, to remind you of the things that you need to do that you are not doing. Thank you.
You made a vital point in terms of supply of service and those, breaches that happen. So even with your best intention as a CSO, those systemic failures must be fixed for your interventions to also work. All right? So I think you also need to do a lot more ensuring that, these breaches we have in the supply of services at that level should actually be curtailed. Because if the common man in the community cannot access a primary healthcare center to access service at the time of need, that individual may not be able to afford private, healthcare service. And then it means, like you said, going back to the traditional medicine man. So thank you for lending your voice to that. I'll come back to you.